So which this gets us to our next category of genetic diseases, that is chromosomal abnormalities. You very well know कि chromosomal abnormalities को हमने दो में divide करा है, that is chromosomal abnormalities in number and structure of chromosomes. You know that. So let us start with chromosomal abnormalities. सबसे पहले मुझे ये बताओ, what is the investigation of choice, IOC, what is the investigation of choice for chromosomal abnormalities versus trisomy 13, that is Patau's syndrome, versus trisomy 13, that is Patau's. Patau's में T भी आ रहा है ना, Patau's में T is coming, so trisomy 13 Patau's. This is a nice normal karyotype. This is a nice normal karyotype. This is what you have to see when you get karyotype analysis. Now you tell me कि अगर ये वाला, if you have been given this image, what is the diagnosis in this? Of course, this is conventional cytogenetics or karyotyping. The minute I see this, सबसे पहले मैंने देखा XX है. That means she is a female. She is a female. What is the problem in this karyotype analysis? It has 3 chromosome 21. That means diagnosis Down syndrome. Diagnosis Downs. So first point, investigation of choice. Investigation of choice for chromosomal abnormalities is conventional cytogenetics or karyotyping. How is it performed? In conventional cytogenetics or karyotyping, in this we add colchicine. इसमें हम लोग colchicine add करते हैं. We add colchicine और colcimid. एक ही बात है. We add colchicine और colcimid, which is a mitotic spindle cell inhibitor. It is a mitotic spindle inhibitor. It inhibits mitosis. ये spindle formation को inhibit करता है. It inhibits mitosis. It inhibits mitosis at metaphase. It inhibits mitosis at metaphase. As a result of which we see the chromosomes being scattered. एक अच्छा सा हमें chromosomal pattern नजर आता है, and we are able to appreciate whether it is normal or if it is associated with some abnormality. This is conventional cytogenetics or karyotyping. Next point. So let us start with chromosomal abnormalities. Let us start with chromosomal abnormalities in number of chromosomes. Chromosomal abnormalities associated with number of chromosomes, associated with number. First point, I can divide chromosomal abnormalities in number into 2 types. इसको हमने 2 में देखा. या तो बच्चे euploidy हो सकता है. The first chromosomal abnormality in number is euploidy. That means it is an increase in number of chromosomes. Euploidy. It is an increase in number. It is an increase in number of chromosomes in multiples of n. It is an increase in number of chromosomes in multiples of n. What is n? N is the haploid number. N is the haploid number, that is 23. All of us, what is normal? All of us, बच्चे, we are 2n. We are diploid. All of us, we are diploid. We are 2n. That is, we have 46 chromosomes. So euploidy, it is an increase in number of chromosomes. It is an increase in number of chromosomes in multiples of n. So examples of euploidy are 3n or 4n. Examples are 3n or 4n. This is euploidy. Next, the next chromosomal abnormality in number of chromosomes is aneuploidy. Next chromosomal abnormality in number is aneuploidy. This is an abnormal number of chromosomes. Not in multiples of n. Not in multiples of n. So examples of aneuploidy are 2n plus 1. क्या एग्जाम्पल बना? 2n plus 1, 2n plus 1 और 2n minus 1. 2n plus 1 मतलब this is the trisomies. These are trisomy. Trisomy 21 Downs, trisomy 18 Edwards syndrome, trisomy 13 Patau's syndrome. These are the trisomies versus 2n minus 1, which are the monosomy. Versus 2n minus 1. 2n minus 1 मतलब one chromosome is lost. 2n minus 1, that is monosomies. So chromosomal abnormalities in number of chromosomes. हम लोगों ने दो टाइप का देखा, euploidy which was abnormality in number in multiples of n, and aneuploidy, that is abnormal number of chromosomes not in multiples of n. Not in multiples of n मतलब 2n plus 1 or minus 1. 2n plus 1 is trisomy, 2n minus 1 are the monosomies. Next point. So let us start. अच्छा एक चीज और देखते हैं. Another chromosomal abnormality. We have seen euploidy and aneuploidy. Another chromosomal abnormality is mosaicism. Next chromosomal abnormality, which is next chromosomal abnormality, is a mosaic. Mosaicism. Mosaicism matlab a particular person has two different sets of chromosomes. Mosaicism matlab different sets or different types of chromosomes. Different sets or different types of chromosomes in a particular individual. That is called as mosaic. मतलब एक ही इंडिविजुअल, एक ही पर्सन या एक ही इंडिविजुअल में दो टाइप के सेल पॉपुलेशन है. सम सेल पॉपुलेशन आर नॉर्मल एंड सम हैव अ डिफरेंट टाइप ऑफ क्रोमोसोम नंबर. दैट इज कुछ नॉर्मल है फॉर एग्जांपल एंड कुछ में ट्राइसोमी 21 है, दैट इज कुछ में डाउन्स है. दिस इज कॉल्ड एज मोज़ेकिज्म. Different sets or different types of chromosomes in a particular individual. Next point. So let us start. Let us start with chromosomal abnormalities in number. Let us start with our first topic in this, that is chromosomal abnormalities. Chromosomal abnormalities in number of chromosomes, and let us start with the first one in this, that is Down syndrome. Starting with the first one, that is Down syndrome. पहले वाले से शुरू करते हैं ना, that is starting with Downs. What is Down syndrome? You already know Down syndrome. This is trisomy 21. This is trisomy 21. क्यों होता है? Trisomy 21 मतलब दो क्रोमोसोम 21 तो नॉर्मल नहीं है. We get one chromosome 21 from the mother, one from the father. इसमें एक एक्स्ट्रा क्रोमोसोम 21 है. Why? What is the pathogenesis? What is the pathogenesis of Downs? Extra chromosome 21 कहाँ से आया? This occurs because of maternal meiotic non-disjunction. This occurs because of maternal meiotic non-disjunction. Maternal meiotic non-disjunction of chromosome 21. मतलब मदर में ड्यूरिंग मियोसिस मेटर्नल मियोटिक नॉन डिस्टिंक्शन ऑफ क्रोमोसोम 21. जब मियोसिस होता है तो डिप्लॉयड नंबर 2n बिकम्स n. डाउन्स क्यों हुआ? इन डाउन सिंड्रोम जब मदर में मियोसिस हुआ, व्हेन मियोसिस अकर्ड इन द मदर, सो डिप्लॉयड नंबर 2n डिड नॉट बिकम n. उसमें क्रोमोसोम 21 डिसजॉइन नहीं हो पाया. Maternal meiotic non-disjunction of chromosome 21. क्यों नहीं डिसजॉइन हो पाया? What was the cause of the same? Main risk factor of maternal meiotic non-disjunction being increasing age of the mother. Father की नहीं. We guys have an advantage like that, I guess. Father की नहीं बचे. Increasing age of the mother more than 35 years drastically increases the risk of Down syndrome. Next. Other causes of Downs are, so main cause of Down syndrome क्या था? Main cause था कि third chromosome 21 जो आया वो mother का आया. This is the most common cause of Down syndrome. Most common cause accounting for 95% of the cases. This is the most common cause. Other causes of Down syndrome are अब हर बार मदर का होना जरूरी नहीं है. 95% cases it is maternal meiotic non-disjunction, but it can be of the father also. It can be associated with paternal meiotic non-disjunction also. Paternal meiotic non-disjunction of chromosome 21. Father का disjoin नहीं हुआ. Or it can occur because of mosaicism. Mosaicism मतलब some cells in a particular person are normal and others are showing trisomy 21. Next cause of Downs is mosaicism. Mosaicism, that is कुछ cells normal है, some have trisomy 21. And lastly, put a star. Lastly, Down syndrome, it is also associated with Robertsonian translocation. It occurs because of Robertsonian translocation 1421. Robertsonian translocation. Translocation matlab, translocation means one part of the chromosome goes to other and vice versa. वो होता है translocation. Robertsonian translocation 1421. Just write it at present. We'll see what we mean by this in extensive detail in just 10 minutes. So, what are the causes? What are the causes of Downs? Most common cause था maternal meiotic non-disjunction of chromosome 21. Other causes are paternal, mosaicism, and Robertsonian translocation. Next point, Down syndrome. Down syndrome, you very well know, we can detect it antenatally. That is, when the child is in the womb of the mother, then we can detect it. So antenatal diagnosis, it is performed in all the cases. Antenatal diagnosis of Down syndrome. Antenatal diagnosis of Downs. Antenatally, we can detect Down syndrome both radiologically and serologically. पहले radiologically देखते हैं, that is abdominal ultrasound किया. Radiologically, Down syndrome is associated with increased nuchal fold thickness. Radiologically, it is associated with increased nuchal fold, increased thickness of the nuchal fold. Nuchal fold thickness मतलब neck की thickness increase हो रही है. I am not interested in telling you that nuchal fold is the space between the vertebra and the subcutaneous tissue of the neck. Technicality है, nobody is going to ask you that. Increased nuchal fold thickness of the neck is increasing radiologically. Next is serologically. For making an antenatal diagnosis of Down syndrome, serologically, we can do the triple screening or quadruple screening of Downs. Triple screening मतलब हम लोगों ने 3 markers देखे, that is AFP, alpha fetoprotein. ट्रिपल स्क्रीनिंग में हमने 3 मार्कर्स देखे, अल्फा फीटोप्रोटीन, बीटा HCG, बीटा ह्यूमन कोरियोनिक गोनाडोट्रोपिन, बीटा HCG and UE3, that is unconjugated estriol. UE3 for triple screening of Downs, UE3, that is unconjugated estriol 3. In Down syndrome, AFP reduces, beta HCG increases and unconjugated estriol reduces. This is triple screening. Of Downs. Simple funda था बच्चे. HCG as such increases in pregnancy. So Downs में it is markedly elevated. So HCG increases, AFP and unconjugated estriol reduces in Downs. This is triple screening. And next is quadruple screening of Downs. Quadruple screening में we add one more marker, that is inhibin A. One more marker is added. We add inhibin A, which also increases in Down syndrome. So quadruple screening में 2 markers increased, 2 markers reduced. This is antenatal screening of Downs. बहुत ही important है. Radiologically, the nuchal fold thickness increases. Serologically, triple screening and quadruple screening. Triple screening में हमने 3 markers देखे, AFP, alpha fetoprotein, beta human chorionic gonadotropin, beta HCG and UE3, unconjugated estriol. Quadruple screening we saw inhibin A also. This is antenatal diagnosis of Down syndrome. Next point, clinically. Next point, clinically Down syndrome. देखो पहला point तो सबको पता है, Downs, you very well know that it is the most common genetic cause of mental retardation. It is the most common genetic cause. It is the most common genetic cause of mental retardation. Down syndrome. It is associated with mental retardation. Next, it is associated with presence of epicanthic folds. It is associated with epicanthic folds and flat facial profile. I'll just show it to you diagrammatically what this looks like, what the child looks like. Epicanthic folds है, facial profile flat है, flat facial profile with presence of transverse simian crease, with presence of transverse simian crease in palm of the hand. एक single deep crease present होती है, which is associated with the presence of transverse simian crease. Next, nuchal fold thickness was increased radiologically also. Remember, antenatally. So clinically, it is associated with abundant neck skin. ये तो हो गए gross features. Next, it also shows CVS abnormalities. Down syndrome. It is associated with the presence of CVS abnormalities. अभी तक हमने क्या क्या देखा? We saw child is mentally retarded. Presence of epicanthic folds with a flat facial profile, transverse simian crease and abundant neck skin. Next, CVS abnormalities, which is the most common CVS abnormality associated with Down syndrome. CVS abnormalities है, heart में defects है. Most common कौन सा है? Normally students tend to mark it as ventricular septal defect, VSD, but no. Most common CVS abnormality is endocardial cushion defects. Most common CVS abnormality in Downs is endocardial cushion defects. Followed by ventricular septal defects, VSD, followed by atrial septal defects. So most common CVS abnormality in Downs is endocardial cushion defect. Most common endocardial cushion defect, followed by ventricular septal defects, followed by ASD, atrial septal defects. Next, Down syndrome, which it is also associated with intestinal obstruction. It is associated with intestinal obstruction. And which is the most common site of intestinal obstruction? Intestines में obstruction हो रही है, ठीक है, मान लिया. But which is the most common site of intestinal obstruction in Downs? That is duodenum. It is associated with duodenal atresia. Duodenum में obstruction होती है. Next, Down syndrome. It shows the presence of increased gap between first and the second toe in the legs. जो first and second toe है, first toe बड़े वाला है, second toe छोटा है ना, there is increased gap between the first and the second toe, which is called as saddle toe deformity. The gap between the first and the second toe is increased, giving rise to saddle toe deformity. Next, a child with Down syndrome is also associated with hypotonia. मसल में टोन कम है, hypotonia, umbilical hernia. Please note, umbilical hernia is a feature of Down syndrome, not Turner syndrome. पूछा जाता है. Umbilical hernia and increased risk of malignancies and increased risk of blood cancer. Which blood cancer? Leukemias. Increased risk of leukemias. बहुत ही important है. देखो अभी तक हमने जो भी points पढ़े हैं with respect to Downs, have a look at them again. Mental retardation obvious था. Mental retardation, transverse simian crease, abundant neck skin, CVS abnormalities, Most common CVS abnormality was endocardial cushion defect, followed by VSD, ventricular septal defect, followed by atrial septal defects. Next, intestinal obstruction. कहाँ पे intestinal obstruction हो रही है? Where is it occurring? Duodenum. It is associated with duodenal atresia. Increased gap between the first and the second toe. That is saddle toe deformity. Hypotonia. The muscle tone is reduced. Hypotonia, umbilical hernia, and increased risk of leukemias. अब increased risk of leukemias के साथ पूछा जाता है. Please put a star. Which is the most common leukemia? Which is the most common leukemia associated with Downs? These set of questions, they are very commonly asked. Leukemia का risk बढ़ा, ठीक है मान लिया. But which is the most common leukemia? Most common leukemia associated with Downs, which is ALL, acute lymphoblastic leukemia. Most common leukemia with Downs. Most common leukemia with Downs is ALL. ALL, that is acute lymphoblastic leukemia. Whereas most common AML with Downs, most common acute myeloid leukemia with Downs. Leukemia दो टाइप की है ना, lymphoblastic leukemia and myeloid leukemia. Overall Downs के साथ most common leukemia with Downs is ALL. Which is the most common AML with Downs? Most common AML with Downs is AML M7. Most common AML with Downs is AML M7. AML M7, also called as acute megakaryocytic leukemia. Also called as acute megakaryocytic leukemia. So what we have seen is, we'll see that in blood cancer also, कि AML M7, AML के अंदर it is the least common AML. It is the least common AML, but it is the most common AML associated with Down syndrome. Next point. अच्छा, इसका एक वेरिएशन पूछा जाता है. Most common leukemia in Downs. Most common leukemia in Downs in less than 3 years of age. Most common leukemia in Downs in less than 3 years. Overall हमने देखा है कि most common leukemia in Downs is ALL. But in a child less than 3 years, most common leukemia in Downs in less than 3 years of age is again AML M7. It is again AML M7. It is again AML M7. These are the clinical features. These are the clinical features associated with Down syndrome. And if I have to show you this in a diagrammatic manner, this is what it looks like. Have a look at this child. The minute I see this, I know that flat epicanthic folds with a flat facial profile, presence of a transverse simian crease, umbilical hernia. Please note, umbilical hernia is a feature of Down syndrome, not Turner's. It is a feature of Down syndrome. पूछा जाता है Down syndrome. The child is mentally retarded. There is abundant neck skin, congenital heart defects, intestinal stenosis, saddle toe deformity, increased gap between the first and the second toe, hypotonia, and increased risk of blood cancers. This is Downs. Versus. Now, have a look at this patient. Have a look at this. What do you see here? Of course, she is a girl who has a short stature. The minute I see this, I am able to make out that she has a short stature. Short stature, her height is less. Short stature with widely spaced nipples. Nipples are widely spaced, and cubitus valgus. Cubitus valgus means the angle between the forearm and the arm is increased. ये angle बढ़ गया ना, that is cubitus valgus. Varus होता तो angle would have been reduced, valgus is increased. So, with low webbed neck. I'll repeat. The girl has a short stature. With widely spaced nipples. Cubitus valgus and low webbed neck. Cubitus valgus and neck भी छोटी है ना, and low webbed neck. All these are the features of Turner syndrome. all these, which is, these are the features of Turner syndrome. So this gets us to our next chromosomal abnormality. This gets us to our next chromosomal abnormality in number of chromosomes, that is Turner syndrome. This gets us to the next one. This gets us to Turner syndrome. What is Turner syndrome? Turner's, it is 45 XO. देखो, we always write total number of chromosomes, comma sex chromosomes. Always. कभी भी इसको ऐसे मत लिखना 44 plus XO. That will be wrong. Total number of chromosomes 45, comma sex chromosomes 45 XO. So in Turner's, clinically, think of it yourself. Female is XX. इसमें one X is missing. So the secondary female sexual characteristics, as a result, secondary female sexual characteristics are reduced. Secondary female sexual characteristics are reduced. So very easy and straightforward. Think of your favorite girl and imagine opposite of her. That is Turner's. So the patient has a short stature. बहुत ही straightforward है बच्चे, बहुत ही straightforward है. Think of your favorite girl and imagine opposite of her. क्योंकि secondary female sexual characteristics are reduced ना. So the girl has a short stature, low webbed neck, widely spaced nipples, streak ovaries. Streak ovaries means there is fibrosis in the ovaries. Streak ovaries. Cubitus valgus, that is the angle is increased. Cubitus valgus and peripheral lymphedema at birth. Peripheral lymphedema at birth. This is Turner syndrome. This is Turner's. The secondary female sexual characteristics are reduced. So let us see the questions associated with this. सबसे पहले मुझे ये बताओ, is it associated with umbilical hernia? No. Turner's, it is not associated with umbilical hernia. Not associated with umbilical hernia. Umbilical hernia is a feature of Down syndrome, not Turner syndrome. पहला point. Next point. The female patient is suffering from amenorrhea. There are streak ovaries. So the girl is suffering from amenorrhea. Amenorrhea matlab she is not bleeding. Is it primary amenorrhea or secondary amenorrhea? What is the difference? Primary amenorrhea means the girl has never bled, versus secondary amenorrhea, which means she was bleeding and now she has stopped. But it is the most common cause of primary amenorrhea. The girl has never bled. She has never bled because of streak ovaries. There is fibrosis in the ovaries. She is suffering from primary amenorrhea. Next point. In Turner syndrome. Next point. FSH and LH. FSH and LH. Low, normal, high. FSH and LH. देखो streak ovaries है. So the hypothalamic pituitary axis is trying to stimulate the ovaries, as a result of which FSH and LH is high. FSH and LH is high. And lastly, IQ. Low, normal, high. देखो guys, you know this. More are the number of X chromosomes, lower is the IQ. Girls, don't beat me on this. देखो, after normal is XX. अगर XXY हो गया, देखो, normal female is XX, male is XY. Male में XY था, अगर XXY हो गया, if the number, so which this gets us to our next category of genetic diseases, that is chromosomal abnormalities. You very well know कि chromosomal abnormalities को हमने दो में divide करा है, that is chromosomal abnormalities in number and structure of chromosomes. You know that. So let us start with chromosomal abnormalities. सबसे पहले मुझे ये बताओ, what is the investigation of choice? IOC. What is the investigation of choice for chromosomal abnormalities versus trisomy 13, that is Patau syndrome, versus